Mastula Nachisozi, a resident of Cheba and Salosalo in Kawempe Division, has been living with HIV and AIDS virus for 19 years. Nachisozi, who is also a lead caregiver in her community, explains the stigma she underwent with her child after the community discovered she was HIV positive.
I was tested for HIV in 2005. That's when I had lost my husband in that same year in March. The stigma and discrimination was too high to the extent that my community members around, the neighbors, would not allow my child to play with their children. I decided to go for a training by Kamosha Christian Caring Community in HIV and AIDS and community health work for a year. After receiving my certificate from Kamosha and KCCA, I now went back to the community and I decided to open up, start moving in homes, encouraging my fellow women to come and we talk about HIV.
Nachisozi explains why she started Kawempe Home-Based Caregivers Alliance and how she beat the stereotyping in her society.
When I first heard the news that I was HIV positive, of course as a person, my life was not the same. I thought about how am I going to leave my child, who was 10 years by then. I thought dying soon because I had just lost a husband. But the stigma and discrimination I encountered within that village, from the neighbors, from the husband's family, now strengthened my heart that I should do something.
Nachisozi finds comfort in taking care of other people living with HIV and AIDS in the community, as well as comforting people affected by domestic violence, sexual assault, among other challenges, with the aim of giving hope and transforming other people's lives. Through their alliance, which brings together several non-government organizations, they have made demands that include providing a comprehensive policy to protect, recognize and provide financial assistance to caregivers.
Our demand is one, that the work of caregivers in this country is recognized, is respected, is rewarded, because they are doing a very instrumental role in ensuring that people are healthy, in ensuring that persons living with HIV get the moral and social support, in ensuring that the persons living with HIV in this country can live and age gracefully.
Behind every person living with HIV is a caregiver, often a woman, a mother, a wife or a daughter who provides essential support, love and care. A comprehensive national policy will ensure that caregivers are recognized, supported and provided with the resources they need to carry out their responsibilities effectively.
The caregivers have elaborated their role in representing people living with HIV and AIDS, persons with disabilities, and fighting for rights of vulnerable groups, for example covering land rights and inclusiveness for people living with HIV to cope with the effects of the virus.
Many of us were affected and infected and stepped out to help those people who have been affected or infected by HIV. We are remembering the milestone. Caregivers have worked to saving lives.
The members of the alliance have also called for funding to home-based caregivers to enable them provide extended advocacy, mobilization, networking, as well as organizing workshops.